Hello, everyone. Welcome to our Advances in Autism Research and Care webinar for May 2019. We are so thrilled to have you. A little housekeeping reminder, if you have any questions that you want to ask throughout the presentation, there's a little questions bar in your little doc that should be on your screen. You can type those in, and I will read them out at the end of the presentation. And this will be recorded and then uploaded to our network YouTube page. So if you want to share this with anyone who wasn't able to attend after, that link will likely be sent out after this presentation. So without further ado, I'm going to welcome Dr. Karen Kolthau, who's our network principal investigator, who will be welcoming our presenter for the day.
Hi, everyone. This is Karen Kolthau, and I am delighted to present Dr. Kristen Sohl, who is an Associate Professor of Clinical Child Health at the University of Missouri Thompson Center for Autism and Neurodevelopmental Disorders, and also Vice Chair of the Child Health Department. She's a pediatrician with extensive experience in medical diagnosis, evaluation, and treatment of children with the concern of autism and other neurodevelopmental disorders. Dr. Sohl is the site principal investigator for the Autism Intervention Research for Physical Health and Autism Treatment Network, and she serves as the PI of the research grant for the network on the ECHO Autism work, and has really built ECHO Autism from nothing to something quite incredible, and we'll speak about that shortly. So I'm delighted to welcome her and think everyone will quite enjoy her talk. Thanks.
Great, thank you. Thanks, everyone. I'm so glad to be here with you, and I hope that you find this next little bit of time together, if not anything, hopefully informative, but then also maybe a touch inspiring, because I think we have a calling as individuals and groups who are really wanting to change the face of how autism is cared for in our country and around the world. I think we have an opportunity to make a major impact, and I hope that throughout our time together today, I will share with you some of the important work that's being done in partnership with many entities, but certainly in key partnership with the Autism Intervention Research Network on Physical Health and the Autism Treatment Network. So we'll get started. And so I want to share with you some information that may be of old hat for some of you, and I imagine most of you on the call are well versed in the prevalence of autism, and we all know that we're now looking at numbers around 1 in 59 children with autism in the United States who are affected by autism. And so certainly, though, we also are aware that there are other studies that show it may even be higher than that. So we know that the increase in autism awareness has truly grown exponentially over the last decade or so, thanks in large part to Autism Speaks and other organizations that have really gone above and beyond to raise that awareness. This awareness has been pivotal in helping families to understand autism, but also has resulted in significant increases in referrals to autism centers like those that many of us on the call represent. So I'm at the University of Missouri, and we have a fantastic autism center here. And certainly I can tell you that we feel the power of autism awareness on a daily basis as more and more families seek answers for their child and for the developmental concerns that they may be having. We also know that there's an increase in the number of children needing help. And so many times as we think about these things, we certainly know that there are impacts that we can be having, but unfortunately, there are few treatment options, there are few trained professionals, and this leads to long wait lists at specialty centers all across the US and frankly across the world. So when I think about autism, I think about these perspectives. I think about the concept of a specialty care center's perspective, the family's perspective, and then also primary care. And what we know is that often these three perspectives operate in silos, not necessarily by intention, but certainly by function. And so well-intended primary care physicians have very little information or training in autism care. So that means that when families come to them seeking answers, they may or may not have the tools that they need to answer those questions. So the primary care folks refer to the specialty care centers who, as we've already discussed, are significantly bogged down with long wait lists and reduced numbers of providers. So what I like to think about is how could things change if we had an improved perspective or kind of a unified perspective from these different angles and others that would then help us to improve our outcomes. So one of those perspectives, being the specialty perspective, I think is important for us to consider. And you may, depending on what walk of life you're joining us from, this may resonate with you, but if it doesn't, I want to share our perspective. So I've been a part of the Autism Treatment Network, which is a co-partnered network between the Autism Intervention Research for Physical Health Network and the Autism Speaks Autism Treatment Network. This group is an incredible group of clinicians, researchers, and parents that have been working together for about the last decade. We worked on diagnostic and treatment guidelines, algorithms, toolkits, on, and have produced numerous and high-quality amounts of clinical research and critical research around autism and medical co-occurring conditions. This is all fantastic and spectacular. However, what we were learning and what we realized was that the more information that we generated and the more great tools we had, that many families were not able to access those tools unless they were coming to one of our centers. So we started to think about how could we turn that on its head and start disseminating that knowledge and those best practices and the resources in a more robust fashion. So in a moment, though, I will dig deeper into that, but I want to remind us that this is a systemic healthcare problem. So we're talking about autism, but many of the details that we talk about today really could be applied to many other chronic conditions that are facing American citizens and others throughout our country. So it's a classic example of supply and demand. We have way more demand for autism services, autism intervention, autism diagnosis than we have supply. We could talk about that for an entire different session about why we don't have very many providers taking care of kids with autism. But what I want us to think about instead is how does this supply and demand problem affect our equality in health? So there's rising inequalities related to healthcare across our country, and this leads to declining health. And we know through multiple sources of research and data that we know this is happening for children with autism as well. We know that they have poor access to primary care. We also know that their parents feel more isolated and have less opportunities to ask questions and to seek answers than even other children with special health care needs. So then I like to think about reimagining the system. So here we have phenomenal subspecialty networks that are working on scientific discovery and putting things into place related to clinical practice, streamlining that care and getting us to a place where there's reduced variability in the care that we provide. However, that then is able to feed advocacy and policy and start to improve outcomes. So I think, this image here that we're looking at looks at these kind of in a series, if you will, and they are obviously way more interconnected than that. But I do think it's important for us to consider all of these pieces in the big puzzle of autism care when we're thinking about how do we fix this situation that we're in with decreased access, decreased capacity for our families, which directly impacts their lifelong outcomes. So one of the things that we think about is this notion of moving knowledge, not patients. So I'm about to tell you more about ECHO. Many of you on the call might know about ECHO already, so I hope to not bore you to tears. But I do want to give you at least a little bit of information about ECHO, and then we're going to talk about what's been going on in the space around ECHO autism over the last 4 years. So the simplest way to think about ECHO is that it's moving knowledge, not patients. So obviously we all know, especially if you're from a rural community, that often it can be a long drive just to get to the doctor for a cold or a quick checkup. So we have to think about, are there other ways for us to be doing this? Dr. Sanjeev Arora created the concept around ECHO, which stands for Extension for Community Healthcare Outcomes. And he started using this model to try to disseminate best practice care through guided practice in the year 2003. Like many physicians, he had a long wait list and people were having a very difficult time getting in to see him for the treatment of hepatitis C. He started using this great concept that he coined ECHO, and then started to see major improvements in those patients' health outcomes when they were cared for by their own community physician that he was guiding. One of the fun stories or examples that he likes to give is about driving. So if any of us as parents were going to try to teach our child to drive, we certainly wouldn't just give them driver's ed manuals and have them take a test and then hand over the keys. We would all know that they needed to have guided practice. And so it's the same thing with complex healthcare. We all know as specialists that what we do in our clinics on a day-to-day basis is complex. We might make it look easy, some of us maybe not, but certainly what we do is complex. And so as we're thinking about this, giving us books, giving us didactics, giving us manuals, and research and all of those things. That's well and good, but it doesn't mean you can hand over the keys for me to take care of a child with autism without any guided practice. And so there are 4 key components about ECHO. We use technology to leverage scarce resources. In this case, it's autism expertise. Then we share best practices to reduce healthcare disparities or other types of disparities. And it all hinges on case-based learning so that people can master complexity through guided practice. And then lastly, the D is monitoring outcomes based on our participants' learning, and in some cases, actual patient level data and outcomes. Many people ask, is ECHO telemedicine? It's not. So telemedicine is a direct one-to-one doctor-patient relationship. I see patients through telemedicine in my own clinic here in Missouri. Now, that means that I'm in my clinic and I see one patient and there's no leveraging of a scarce resource. That patient benefits because they don't have to drive to see me, but I have not amplified my knowledge in any way. ECHO is different in that you take a hub of experts, and you teach learners. You guide them through their practice, and then they in turn take care of their own patient population in a more experienced way, thus leveraging and increasing capacity. Again, it is a hub and spoke model, so you often think about it as a hub in the middle where you're going to have content experts. In our case, I'll talk about the details related to that. And then you have spokes of learners. The beauty of ECHO is it can be used for many, many things. It's been used for community policing, where you have a hub of experts related to conflict resolution, de-escalation strategies, riots, things like that. And then the spokes are various police departments across the US. It's been used in education. It's been used extensively in medicine. Lots and lots of applications here with this simple yet very powerful model around hub and spoke. This is what it looks like. So you all are joining us today through GoToWebinar, and you're not able to see me. But on ECHO, you use video-based teleconferencing, and this is kind of what it looks like. You might have a hub team that's sitting together down there in the corner with that big red Project ECHO sign, and then you have lots and lots of spokes that are from all around, can be from all around the world or all around a state, that are all learning together about a complex condition. For autism, here's how we've set this up. And I'm getting ready to kind of start talking about the work that we've done over the last little over 4 years. But the basic premise has maintained this same consistency. So ECHO Autism in general meets 90 minutes 2 times a month. Here in Missouri, this is what our hub team looks like. We have myself, I'm a pediatrician that practices developmental behavioral pediatrics. We have a clinical psychologist, a child and adolescent psychiatrist, a registered dietitian, a parent advocate, and a resource expert. And the basic structure is introductions, case presentation, questions and recommendations, a brief didactic, usually between 15 and 20 minutes, all shaped around a core set of curriculum, and then wrap up. Our goal here is to increase local access to high quality healthcare for children with autism. Here in Missouri, we've been running the ECHO Autism program continuously since 2015. We like to say that we run like clockwork, and that there are really no options, or not no options, but there are very, very few times that we will cancel clinic. We feel very strongly that these primary care physicians and practitioners have dedicated their time to learning something new and taking care of children with autism. So we like to be very keenly invested in their learning, and we try not to cancel clinic. We've had well over 470 unique individuals participate in our clinic and have held 98 or so sessions and delivered about 780 CME hours or continuing medical education hours. We did study this as our original pilot. It was a 6-month pilot, and we were able to specifically focus on screening and identification of autism symptoms. We also then focused on helping primary care providers to manage common medical and psychiatric conditions. The results were very encouraging. So we were able to show that the implementation of ECHO Autism was feasible. The primary care participants reported high satisfaction with the program, and that primary care physicians and practitioners demonstrated improvements in self-efficacy in autism screening and management, as shown here. And then also able to see that they had significant improvement in the use of ASD-specific resources. And then there's one more clip that I'll show you, but this breaks it down across our subskills around screening, the use of resources, recognition of medical conditions, psychiatric conditions, and then we had an additional category as well. All of this work and all of our evaluation work has been led by Dr. Micah Mazurek, who was at the University of Missouri, but is now at the University of Virginia. And she continues to be a key partner and a key person in our work here related to the spread of echo autism. We also were able to see a nice improvement in adherence to AAP screening guidelines. So at the start of our echo autism program in 2015, our primary care providers were reporting that they adhered to AAP screening guidelines 30% of the time. So in other words, they were using the tools that they should be using 100% of it at the 30% mark. And then at the end, they were actually reporting about a 50% increase in the times that they adhered 100% to those guidelines. Of course, all self-report, and so then therefore opportunities for a larger sample and more direct measures. That leads us to this great work that we've been doing in partnership with Dr. Kulthau and the AARC network and Autism Speaks. So we were able to take the information that we learned from our pilot here in Missouri in 2015 and apply that then to a replication trial across 10 sites within the Autism Treatment Network. They're represented here by little blue puzzle pieces, and so you can see those on the map on the screen. We had 1 site in Canada and then 9 sites across the US. The results are encouraging. So here are what our participants look like. We enrolled 148 individuals, and we had more than 100, or we had 129 of them attend more than 1 session, with the average attendance being 10 sessions, which I have to say, as a doctor, I am pretty proud of that, because oftentimes just getting anywhere for a session could be a major hurdle. So I'm very pleased to see that we had such nice average attendance. You can see the vast majority of our participants were pediatricians, but we did have some other types of specialties. And here in Missouri, we can say that this also bears true, but we also have quite a few nurse practitioners and a handful of family physicians as well. Here are the general results. Now, we're not sharing a ton of results today because we are still in the process of publishing this data, but we are able to share some things with you, and we hope that you find them helpful. So our primary and secondary results showed that we had a significant increase in autism screening, general developmental screening, autism knowledge, and overall self-efficacy. A comment about this. So the way we did this, I didn't put in a lot of slides about our study design just for the purposes of getting to our kind of breadth of this topic, but we did chart review. We did chart review at 4 different intervals: baseline, at 3 months, at 6 months, so the end of the 6-month intervention, and then 3 months post-intervention to see how things went. And so those were actual chart reviews in the 148 doctors' offices that participated in this study. Very proud that we did show statistically significant increases in those aspects. And then certainly the autism knowledge was a knowledge-based test, and the overall self-efficacy was still a self-reported self-efficacy scale. We also showed a nice decrease in the number of perceived barriers to caring for children with autism. In my mind, this is probably the thing I'm most proud of, because I know that as a general pediatrician, for those of you who don't know, I did general pediatrics for about 5 years while I was building my developmental peds practice. And I can tell you that it's very tough when you've only had 4 weeks of training in any development, like developmental disability, during your training. It makes it very challenging to want to seek out and or become good at taking care of children with autism or other developmental disabilities. So the fact that we were able to show decreased perceived barriers is a very big, thing to me, and I'm proud of that. We did not show statistically significant change in comorbidity management, and we will show you some of those graphs here. So again, Dr. Mazurek, Dr. Bob Parker, and Dr. Karen Kulthau were keyly instrumental in developing this study and running it with us for the last 4 years. Here you can see the data that I just talked about, but you can see where things were at pre-echo, mid-echo, post-echo, and then follow-up. So again, really proud of this practice change that we were able to show. Knowledge and self-efficacy, you can also see here across those 4 time points. And then reduction in barriers to care, again, across the 4 different time points. So we do see that there's an improvement in their, almost an incremental improvement in their openness and or report of barriers to care being reduced over their participation in ECHO. So we're pleased to see that as well. Because again, if we want to build a workforce that's willing and able and invested in caring for these, for our patients and for these kiddos, then we certainly have to find ways to reduce these barriers to care. So I've talked some about our ECHO autism, what I like to think of as our original model. So the model where we focused very heavily on helping primary care physicians and practitioners identify symptoms of autism, as well as manage common medical and psychiatric conditions. So much of the great work that's been done through the Autism Treatment Network has focused on those core issues, particularly related to medical and psychiatric conditions. We've got tons of fantastic toolkits, algorithms, consensus guidelines, research, etc., that has really formed the curriculum that we've used to then disseminate that information and knowledge and skill set out into the community. But what our team noticed as we were continuing to do our work here in Missouri, we again started our work in 2015. And so as the study was going, that was 2016, 2017. So here in Missouri, we kept pushing forward and kept thinking and trying to think about how we could push the envelope even more so that we could get even more traction related to community-based care for children with autism. So what I'm going to tell you about now is what I think about related to, or what I like to call Echo Autism 2.0, which we call Echo Autism STAT. The STAT, for those of you who are not familiar with it, is a secondary screener, and it stands for the Screening Tool for Autism in Toddlers and Young Children. This tool was developed by Dr. Wendy Stone and her team at Vanderbilt. She's now at the University of Washington. And essentially, it's a great direct behavioral observation that can be used in a primary care office to essentially directly assess behaviors that are most common in children with autism. So when we think about this, and when I was thinking about Echo Autism and how could we accelerate early diagnosis, we started trying to figure out what were we missing within our Echo Autism core. And what we knew is that we were teaching primary care physicians and practitioners how to recognize symptoms of autism, how to take really good histories, but yet we did not have a direct behavioral observation, which is pretty much paramount when you're doing a behavioral diagnosis. So being very astute and keen on having high quality output, we started playing around with ideas so that we could think about ways to make diagnoses through the Echo Autism program. So what we did was we brought in our primary care providers, a good handful of them, about 15 to 20, and taught them the STAT measure. And then we also engaged them in even more rigorous preparation to be able to do a comprehensive DSM-5 based diagnostic interview, and then expedite or teach them how to make those diagnoses. They would then present that compilation of material back to the Echo Autism Hub team, so virtually, and then we would help determine if that child met criteria for autism or not. So it was a lot of mouthful for one slide, so I'm going to skip forward, and don't panic if you're not following me, because I've got a couple more slides to help make that a little bit clearer. So here's the map of Missouri, in case some of you don't know where that is. We live in Missouri. We got hit by a ton of tornadoes last night, and it was pretty scary. I will say that here in Columbia, we are right in the middle of the state with that. It's kind of hard. I don't think I have a pointer, so I can't quite show you, but we're in Columbia, Missouri. We are safe. About 30 minutes to the south of us is where one of the major tornadoes hit. It hit our state capital. And so Missouri certainly had a rough night last night because there were tornadoes that hit in several other places too. So this is the map of Missouri. And we have Echo Autism trained providers across the state of Missouri. Each one of those little gold MU, which stands for the University of Missouri, represents a pediatrician, family practitioner, or a nurse practitioner in each of those locations. We set a goal for ourselves. We started this program in the fall of 2016, and we set a goal to try to get all children, not children with autism, but any child within the state of Missouri, within 60 miles of an Echo Autism provider. And we reached that goal in November 2017, just a short year later. We now have 19 primary care physicians and practitioners who are able to evaluate and diagnose children under the age of 48 months with obvious symptoms of autism. What that means is these kids are getting the care they need, when they need it, where they need it, and how they need it. So for example, instead of being on a wait list to a tertiary care center like here in Columbia, St. Louis, Kansas City, or several other locations, they can go to one of these 19 access points and be evaluated. Now, of course, if they have more subtle symptoms or if they have more complex needs, they're certainly going to then move on to the next level. But those kiddos are now able to get the care they need without the wait and right in their own backyard. We think about this as a multi-tiered autism diagnostic process. And again, Dr. Micah Mazurek, as well as Alicia Curran and Courtney Burnett, have all been very instrumental in helping us design this. Ideal state would be that all children at the requisite well-child visits received their universal screening, just like the AAP guidelines and many others state. They would get that universal screening. If they were at risk, they could move on then to a primary care-based diagnostic assessment, which would include the STAT in a person who's trained to do the STAT, a diagnostic interview, and then present that information to an eco-autism team, in this case here in Missouri, who would help to differentiate whether those kids were unambiguous, if they had unambiguous symptoms and could receive a primary care diagnosis, or if they needed to be referred on for further evaluation and more assessment. This way, it allows us to essentially think through the process by which we do this and not just have every kid go through the same process. We did a study of this as well, and we did, again, like I mentioned, training on screening and diagnosis using a multi-tiered risk stratified approach, like I just showed you, and continued to teach them management as well. We essentially added this on as another element to what we were doing through eco-autism. If you want to read the full paper, we'd love for you to do that. It's in the Journal of Autism and Developmental Disorders in the August 2018 issue. We also tracked screening. So we we developed a maintenance of certification module. For those of you who are not in the physician field, that stands for MOC, or so maintenance of certification, and abbreviated MOC. In order for us to keep our board certification, we have to get several different kinds of credits. One of those is in quality or process improvement. So we developed a MOC Part 4 module that went hand in hand with our eco-autism curriculum. This data that you're looking at right here is developmental screening and autism-specific screening data at each of our autism sites, or our eco-autism sites, over time. We essentially embedded a learning health network into our eco-autism clinic and then helped them over time gradually increase their rate of screening, helping them with barriers, helping with whatever the case needed to be, and they helped each other. So we're pretty proud of this too. We did, this graph doesn't show it, but we did do a 12-month follow-up to this data and did maintain that above 95% goal line across the board. So very pleased with those results. So our paper showed that 16 primary care providers and physicians and practitioners achieved reliability on administrating the STAT evaluation. What that means is they did submit their video tape, files for their administration and did calibrated or reliable to our STAT trainer. We showed that they increased their self-efficacy in autism screening and management. 47 cases were presented for diagnostic consideration. 31 were diagnosed with autism. 16 were referred for further evaluation. Families avoided an average of 173 miles of travel. Diagnostic wait time was eliminated for the families who received a diagnosis and accelerated for those who needed to come in for further evaluation. Next steps, we have completed our diagnostic validation study, but the analysis is underway. So the way we think about this is the Missouri diagnostic model, kind of the right care at the right time and in the right place. In Missouri, we have Missouri Autism Guidelines that were published about 5 to 7 years ago, and it broke things into tiers. Tier 1 being unambiguous symptoms, very clear autism symptoms. Tier 2 being a little bit more complex, and then Tier 3 obviously being more complex. And so when we think about this, we wanted to figure out a way to stratify who goes where, and could we reduce our wait list across the state or across the system using this method. You'll notice the bidirectional arrow between Tier 1 and Tier 2, and that's going to be important when I get to our next slide, because what we're trying to do here is get us to something that we call autism-ready communities. And I'm going to talk more about that here in just a moment, but I want you to be thinking about what that might look like and how we're trying to build that in Missouri and how your own state or wherever you may be could be instrumental in growing that as well. So we knew that we had these great access points highlighted here in yellow for primary care physicians and practitioners. But we knew that if every one of those docs started to send their patients into places in, tertiary care centers in Columbia, St. Louis, or Kansas City, that really wasn't going to impact the wait list as much as we wanted. Also, we knew that the vast majority of kids sitting on wait lists were over 48 months. So we knew we had to continue thinking and pushing the envelope into new ways to reduce that wait list. So in January 2018, thanks to a partnership with Dr. Stephen Canny at the University of Missouri, as well as my team, we created Eco-Autism Diagnostics. This is the same notion of using Echo to support community providers, but instead of being physicians and nurse practitioners, now we're supporting community psychologists. So here we're helping to guide practice of community-based diagnosticians, in this case, community psychologists, to make diagnoses of autism through this ECHO process. They came in and were trained on the ADOS. They were calibrated to our trainers, and then they had that guided practice as well as high yield topics delivered to them through the ECHO model. We now are able to proudly say that our map looks a little different today. So all of the white MUs represent our community diagnosticians. And as you'll see, they're roughly co-located in the areas where we have community pediatricians, family physicians, and nurse practitioners. The intent is for the bi-directional arrows. One of the things that we know, and I know there's some feedback, so I'm hoping you guys can hear me. So one of the things that we know is that kids with autism, if there's a concern of autism, it's a multi-tiered approach. It's not just see the psychologist and be done, or it's not just see the doctor and be done. It's a team, and we want our children to have comprehensive evaluations. So by co-locating these folks, they're now able to share that care back and forth. So if a pediatrician sees a child with autism and or sees a child for an evaluation of autism and they're not 100% sure that that's what it is, they can send on to the next tier diagnostician who can do additional assessments, the ADOS, for example, the adaptive measures, cognitive measures, things like that. Again, all without that family having to travel. So we know, evidence tells us, research tells us that families do better when their care is provided locally by people that they know and people that they trust. So we're really proud of that. And then vice versa. So we also know that community psychologists, community diagnosticians, that's only one piece of the pie. What if that child has seizures or constipation or sleep problems? So they also refer back to the ECHO Autism primary care provider who screens and assesses and manages common medical and psychiatric conditions, thereby again providing that comprehensive care for that child and that family, regardless of where they are. So moving us forward into some of the work that we've been doing, and I'm going to take a pause here for just a second because I've been hearing kind of feedback for a bit. So I'm not sure, Megan, if you're able to manage that, or I'm not sure, but
yeah, I can take a look. Okay. Let me try. It looks like everyone's muted, so I'm pretty confused at what's going on, but I'll do my best.
Okay, sounds good. It's nice and quiet in my office, so it's not me because I've checked a couple of times thinking like, is there some way it's me? All right, so no worries. All right, so we're moving in now to kind of this expansion idea where I mentioned autism ready communities, but essentially what I'd like you to think about with me is, what if there was a solution to long wait lists? What if we really didn't have to tolerate or accept the fact that that's the way it is? We all know that there are on average 9 to 12 to 15-month wait lists across our country. And we also know that no other condition would stand for that kind of long wait to seek answers. So I want us to think about what if there was another way. Also, what if there was a new way to support individuals with autism right where they live? And what if there was a new way to provide high quality care to patients? Again, something you heard me say earlier is that I'm not about shortcutting people just so that they get care closer to their home. This is about providing high quality partnerships for patients wherever they live, partnering specialty centers with their local providers, etc. So we also want to think about, what if all people with autism had access to evidence-based diagnosis and treatment, again, regardless of where they lived. And I like to say here, regardless of wherever they live, and I'll share with you some exciting things that we've been up to here in just a moment. So we put together this notion of autism ready communities. This is essentially an opportunity for us to create equipped communities around currently 4 or so different topics, using ECHO Autism as the vehicle by which we can create and infuse this knowledge into communities to support these different kinds of providers. So as a point of clarification, I don't want you to think that this is one giant ECHO. It isn't. One of the bullet points actually is an individual ECHO. For example, we could support school nurses through an ECHO Autism program so that they are equipped to help and support the children that they see in their schools who have autism. We're going to talk more about crisis care and transition to adulthood in a moment. The ones that we've been working on, as you've heard me talk about already, are the ECHO Autism primary care, ECHO Autism STAT, and ECHO Autism Diagnostics. We've also been very busy with many of our partners looking at ways and developing ways to support school psychologists, teachers, special educators, as well as ABA therapists, and we have a couple of new ones that are getting ready to start soon. You'll see smack dab in the middle is who I think is the most important. So families are the gateway to autism ready. And so when I think about how can families be empowered, how can families be supported through something like ECHO or through something along the lines of autism ready communities, I certainly see them as being critical to this mission, and we'll talk a little bit about that as we move on as well. So the vision here is to equip all communities to care and support individuals with autism and their families through best practices, regardless of geographic location. We also want to utilize the ECHO Autism model to mentor and guide community practitioners, educators, and advocates to create local expertise and increase access for individuals with autism and their families. For those of you who like to see visuals in different ways, this is another way to think about it. Our original impact that you've heard about today was in primary care and also primary care diagnostics with the STAT. We have ongoing current initiatives around diagnosis, school psychology, behavior analysis, education, crisis care, and transition. And we have future ECHOs planned for school health, meaning school nurses, behavior solutions, which is a broad ECHO looking at different opportunities to support people with autism in the community, whether that be at the dentist office, the primary care office, the eye doctor, wherever that might be. That team is pretty fun and unique. So there are clinical psychologists, BCBAs, child life experts, as well as physicians and parents on that hub team, all working towards helping community learners to apply behavior solutions so that our kids and our families can access services where they need to be. We also have started one called ECHO Autism Center Development and Support. This is for other autism centers. Some of you may be a part of this, to work together. This is often a very large community of learners, and we all get to work together on how we address wait lists, how do we do triage, what do we do with billing, all kinds of interesting and novel things that we're working on together. Early intervention and then family advocates are two other growth opportunities. So I wanted to specifically call out a couple of interesting and innovative approaches that we're using within ECHO Autism and under the auspices of autism ready communities. So we know that, and I bet most of you on the call would agree, that there is a major gap in what happens to patients with autism when they have a behavioral crisis. Many of them may have a community mental health provider. But unfortunately, when a behavior crisis hits, they end up in the emergency department. And sadly, there's often very little information transferred from the community mental health person to the emergency department. And of course, anytime there's limited communication, we often will have either, lack of expertise in helping that family, or in sadly many situations, restraints, chemical and/or physical restraints, or other adverse outcomes that we think could be avoided. Then, as that patient then transitions through what I call the crisis care continuum, they head on into the inpatient psychiatry space, which also, for those of you who don't know this, they're not all inpatient child psychiatry units have experience in taking care of kids with autism. So certainly that is challenging when you have a child who may be minimally verbal or other issues in a major behavior crisis, and yet your inpatient team may not be as equipped as they can be. So we decided to make an ECHO to see if that would be useful. Our hub team includes a child psychiatrist, a clinical psychologist, a parent. By the way, a parent is on every single one of our ECHO autism programs. We feel strongly that parents are critical to what we are teaching any of our learners. We also have a social worker and a clinical pharmacologist. The goals are to increase provider self-efficacy around supporting patients with autism around behavioral crisis through evidence-based strategies in de-escalation and pharmacotherapy, as well as ongoing interventions and support. It's also to help manage common psychiatric co-occurring conditions and challenging behavior in individuals so that we can maximize family-centered best practice care in the least restrictive environment. I could go on for quite some time about the horror stories of my own patients getting stuck in a process that was not family-centered and was not in the least restrictive environment. And so I'm pleased to say that this clinic launched in February 2019 and has been going very well. It's generously funded by our Missouri Department of Mental Health, and we are very thankful that they partnered with us on this to really think about how could we change this, how could we not only improve care, but reduce costs to the system, as well as enhance the experience that families are having when they go through this process. It's stressful enough, and I think that our healthcare system is prepared and ready to do a better job as they take care of these children. We also did a great pilot of the Echo Autism transition to adulthood. This was funded by our AARC colleagues and has continued to go on past our initial pilot. Participants are pediatric and adult primary care. The hub team is led by an adult neurologist, Dr. Gary Stobie from the University of Washington. We also have a broad hub team with a med-peds physician, a parent, a family navigator, a self-advocate, and a psychologist. Really proud of having a self-advocate on this particular echo. He has added a tremendous amount of perspective and lived experience through this process. The goals here, and I want you all to think about this because I know there's a lot of buzz about transition to adulthood, and I agree. But one of the things we have to think about is as we support children and their families through transition, and often are finding ourselves thinking, why don't we have any adult providers who will take care of these kids? Well, we don't have pediatric providers who are packaging these children and preparing them to go over to adult primary care. Conversely, we don't have adult primary care providers who know what to do in most cases with our kids as they transition over. So this echo was specifically designed to try to support patients with autism and their families through this transition through appropriate handoffs between pediatric and adult primary care. Topics include everything from, guardianships, sexuality, self-advocacy tools, financial management, all kinds of life skills and various aspects like that. But certainly the goal here is so that we can get more useful communication going between pediatric and adult providers so we can have more access for our patients and their families to adult primary care, because we know that's critical. And sadly, huge cliff effect for most people, not just people with autism, after they turn 18 into the primary care space. And so this is trying to address that very issue. You heard me mention briefly the Center Development and Support, and essentially this clinic launched also in February, and it is other autism centers. And so these are phenomenal autism centers of varying stages of development. Some are very seasoned autism centers, and some are wanting to become an autism center. And essentially, we lead them through case-based learning, as well as implementation of best practices that we've learned through running our own centers, as well as working across our teams through the Autism Treatment Network. This has been really fun. We almost think about it as a support group for autism centers and are learning a lot, both from the other sites and from each other. So we are very much excited about what we're learning through this Echo Autism method. We do have a large Echo Autism collaborative, which I would invite any of you to learn more about and to be part of. This is a very small list of our collaborators. It does not include any of our study sites. So if you're on the call from one of the study sites, don't panic. There's just not enough space on this one particular slide. But I want to draw your attention to a couple of key partners. So we have really strong Echo programs that are serving the Navajo Nation, the Alaskan Native population, and a shout out to some of our international sites. Because the thing is, in many of our partnering countries, they don't have resources to do this, and yet they figured out how to do this. So we have specialty teams in Nairobi, Kenya, Montevideo, Uruguay, Mumbai, India, and several others that are just about to launch that are utilizing this curriculum that we've made and have adapted to their own cultures, and then using that to disseminate best practices and family-centered care throughout their countries. The UMEAD Center in Mumbai, India is led by Koyali Sengupta. She's a developmental pediatrician, and her work is astounding. She's reached an additional 27 spokes, so learners, in I believe it's 8 different countries, as well as 6 states across India. That's huge reach. She's reaching and getting evidence-based, cutting edge, and practical information to Sri Lanka, Bangladesh, Iran, and many others. Very, very proud of what they're doing. And same thing in Kenya. They're reaching Rwanda, Uganda, Tanzania, on and on. And so when I think about, again, when you go back to those first few slides we talked about, the Autism Treatment Network, and probably many of you on the call who may or may not be affiliated with that program, you know that you have incredible tools at your fingertips in your centers, but you also know, I would imagine, if you think about it, that those may not be being disseminated out into the rural and underserved areas in your own neck of the woods. So what I love most about ECHO is it's allowing us to make impact into the breadth and the depths of rural and underserved America, but also the globe. And so when we think about that, and we think about, like, I had the privilege of getting to go to Kenya a few months ago, and knowing that they're coming to me asking me about the ATN toolkits for sleep was amazing. So knowing that children now in Nairobi and in Rwanda have access to various videos that have been made, or various toolkits or algorithms or whatever, that is how we totally change how we take care of kids with autism. And I am so thankful to the people listed on this slide and the many others, because again, this is a very short list, who are part of the ECHO Autism Collaborative. We also have phenomenal partners. The Thompson Center has been a tremendous partner at the beginning of our journey. We are continuing that under the auspices of the School of Medicine. We also have great support from our Missouri Department of Mental Health. And then, of course, the original, the ideas and all of the original work coming out of Autism Speaks and Autism Treatment Network and the AARC could absolutely not have done this without them. And then not first and foremost, but lastly, ECHO. So Project ECHO is transforming healthcare across the world. I've told you all about autism, but I could have sat here for an hour and told you about cancer or hepatitis C or HIV or tuberculosis or malaria or chronic pain, on and on and on. It's a way of sharing knowledge that's never really been done before. And so I would encourage you, if this is at all interested you, to think about how you could be part of the ECHO. ECHO has gotten tremendous support both from the federal government as well as many state governments. In fact, just yesterday, the ECHO Autism Act of 2019, there was also one of 2016, but the ECHO Autism Act of 2019 just got proposed in this US Senate. And so that is going to help support the growth of ECHO so that we can really think about healthcare in a dynamic in a way that we have not done before. We would love to have you be part of any and all of the work that we're doing. We have much work to be done, but we're very, very encouraged by what we have accomplished and would love to have any of you who are listening today, and if you're not already a partner, join us to be a partner. I am happy to take chatted in questions. I also want to draw your attention to the fact that you can go to any one of these entities and find out more information. One particular entity that you can go to get directly connected to me and my team is echoautism.org. But frankly, you could probably Google any of these things and get connected to people who could help you along your journey. The whole mission of this is to bring best practice autism care to our communities. I know this says primary care because today's focus was primarily on primary care, but it really is this notion of autism-ready communities and figuring out how do we share our knowledge, how do we move knowledge and not patients, and get all families, regardless of where they live, to have access to best practice autism care. So I hope this has been informative, and if you have questions, feel free to type those into the box, and I am more than happy to take any questions that you have. Thank you for your time.
Thank you so much, Kristen. That was so wonderful. I want to apologize to you and everyone for the feedback. I'm truly confused on what was going on there because it looks like everyone was muted, but hopefully we've gotten past that. We do have a few questions, so I'll read them out. And as Kristen said, there's a little questions and a chat box in there. If you have anything you'd like to type in, I'm happy to read them. So the first question we had for you, Kristen, and that was, one barrier that I am dealing with is that in rural areas, there are many families who believe that the only quality diagnostics and treatment are available at university centers. How has your program addressed this old misconception?
Yeah, great question. So thank you for that question. And so I will say that I think what we've done, and it's worked quite nicely, we've made a very rigorous process for these the community psychologists and pediatricians, family docs, and nurse practitioners. It's not a 2-hour, kind of get certified and go about your business, or, it's a big process. And so I think we make that clear. The other thing I will say is that we did a lot of work with our Missouri agencies, so the Missouri Department of Mental Health and our Department of Developmental Disabilities, in working with them to understand what we were trying to do. So to be clear, our process is that the diagnostician comes in for a hands-on in-person training. So if you're primary care, you get the STAT. If you're psychology, you get the ADOS. Then you are supported through the ECHO process for about 6 months as you get good at giving one of those two tests, again, depending on what context you're coming from. You also learn diagnostic interviewing skills and differential diagnosis through the echo process. At that point, then, you're eligible as one of those participants to present your compilation of material to the Echo Autism team for what we call Echo Autism verification. So I think that that's how we've gotten such tremendous buy-in across the state of Missouri, and we're also doing a little bit of this in New Mexico, is that it's a very robust program. So families feel like, whoa, okay, awesome. Like my doctor, my pediatrician is directly connected to the experts up at the, at the medical center. And they feel very good about that. The other thing that Echo does is, because it's instrumental to have this community, that pediatrician's really never out there on their own. So if they have a question, they text me. If they need something, they call me, they email me, whatever. And so that, I think, is how we've been able to get around that notion of like, but no, I don't believe you. I want to go to the academic medical center. So I hope that answered your question. I think the nutshell answer is it's about making a very sound diagnostic pathway that is high quality, so that you can tell the family, like, look, you're getting the best. I'm connected to the right people. I know what I'm doing. So hopefully that was helpful.
Yes, thank you so much. One other question we had was, can you comment on the work you've done with state legislatures, Echo as possibilities related to saving costs for healthcare?
Yeah, absolutely. So here in Missouri, I'll be honest, like we are very, very lucky. We have had tremendous relationships with the state legislature for a long time, thanks in most part to the Missouri Telehealth Network and their groundbreaking work in telemedicine, traditional telemedicine. But that allowed us then to leverage that relationship to get tremendous state legislative support for Echo. So approximately 2 or 3 years ago, we were, Show Me Echo, as we call our larger program, was received general operating dollars for about $1.5 million through the state's appropriations. And that's an ongoing state budget line item that supports all of the echoes that we have through Show Me Echo. Then also the legislators were very instrumental in helping us to work with our Medicaid agencies to get a per member per month fee attached to the Medicaid dollars. My lingo may not be perfect on this, but bear with me. So now we're getting another $3+ million into Show Me Echo each year to support these other echoes. And there's about 12. Echo Autism is one of them. But certainly we are able to make major inroads into our health disparities here in Missouri because of that. So I think if you're in a state that doesn't have that type of history with your state legislature and agencies and administrations, then my advice is to talk to them, help them understand, like, look, in rural North Carolina, rural Tennessee, rural, and you fill in the blank, rural everywhere, we have these health disparities. And there's this project called Echo. And I will tell you that Project Echo now is in, I actually can't think of a state that it's not in. Now, that doesn't mean the autism part, but the broader Project Echo is in just about every state. I mean, you heard me talk about the federal legislation in 2016 and then the one that was just done in 2019. So most places have a little bit of footing somewhere, and that's where you start to go and talk and show them the data. Show them the data around, this is working, your investment in this, which, by the way, it's a very inexpensive model, will yield returns, return on investment, return on value, things like that are very powerful right now. So that would be my advice. And I'm certainly happy to talk to whoever asked that question on the back end. I love legislative policy, and so would be happy to talk through that in more depth. But the moral of the story is it's about relationships, and you got to start somewhere. So then it's just about making some inroads and helping them to see how this could be useful.
Thank you so much. Wonderful. Yeah, I'll let that question asker know that they can reach out to you after if they have other questions or want to chat more about it. I think we have one more question. So the last question we have for the day is, can you expand upon or just tell us about some challenges you've seen with using this approach with autism specifically, compared to when using it with the other conditions that you mentioned?
Yeah, so also a great question. So I think in a nutshell, autism doesn't have a biomarker. So I'm super jealous when I watch my friends who do echo around hepatitis C or HIV because they can get through 10 or 12 cases in a given session, which is a lot more than we can get through because they're able to rattle off, this is the viral load and this is this and da 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 da. And then the experts are able to say, okay, do this, do that, da 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 da, whatever. But with autism, it's much, 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 much more nuanced than that, as I'm sure most of you know. So I'd say that's a challenge, but it's also a huge opportunity that has not really held us back any, because we get to have a really fascinating deep dive into many of the issues that all of us experience when we're taking care of kids with autism. So I do think it's a challenge because it's not as cut and dried. Which is why we have to have, trainings on diagnostic tools and stuff like that, because we don't have a quick blood test that will tell us what we need to know. So I think that's challenge number one. I think challenge number two, although this is a challenge all around any echo, not just echo autism, is getting the physician or provider community to allocate the time to participate in echo. So where this comes in is that, again, return on value, that value equation, and helping people to understand, okay, look, you're taking care of these kids anyway, and you are frustrated by taking care of them because you don't know what to do. So you then call the referring, you call the local specialist, and you're frustrated again because that might take a while or whatever. So it's helping them to see, them being a primary care provider, helping them to see that actually putting some work into the front end will make their clinic more efficient, more effective, and provide better care for their patients. So that's been really helpful for many of the providers that we have. Then the other piece that's been helpful is that primary care providers are hungry to be able to gain more knowledge and offer this type of expertise in their communities. So the folks that you've heard me talk about today, the primary care physicians and practitioners, they have become local experts. I would say about 50% of them have all created half days of their weekly clinics and have them specific for kids with autism. These are general pediatricians who had zero knowledge about autism, or the same baseline as every other pediatrician, until they started echo autism. And now they've dedicated, let's say, Wednesday afternoon to seeing kids with autism, either as returns or diagnostics. That's amazing. They're receiving referrals from all of their colleagues in their region so that they can then get quicker access to the answers that their families need. And I think that's the power also behind this community. So, for example, you may have experts in hepatitis C in one town and autism in the next town, and then you kind of share your expertise. So not everybody has to do autism, and not everybody has to do hepatitis C. So anyway, the long and short of it is there are lots and lots of lessons that can be learned. I think we all struggle with having enough time to do the things that we want to do, and that's probably never going to go away. But I do think ECHO is a highly effective way to accelerate healthcare in our current system.
All right. Thank you so much, Dr. Soul. This was truly informative and also very inspiring, as you said it would be. So yeah, thank you so much. And I want to remind everyone that this will be put up on our network YouTube page. Thank you all for coming as well. We really appreciate you tuning into these. All right. With that, we're going to sign off. Thanks, Kristen. Thank you, everyone.